Hey there, everyone. Good evening. Welcome back to I Care for Your Brain with board-certified neuropsychologist Dr. Karen Sullivan. That is me. I am so excited to be with so many new people tonight. We love our golden oldies who have been with us for 3 years now, every Wednesday night with these free brain health lectures. But I think we are welcoming in a whole new slew of people from the orthostatic tremor community. And last week when I was with you, I did my first lecture on the topic, and I have to tell you that I was totally blown away by the enthusiasm, the reception that I got, the support. In just 2 days, the lecture had almost 5,000 viewers, and that was very touching to me, not just because of the numbers, but it really meant a lot to me because I felt that we really started to meet the unmet needs of this brain health community. There was so much validation that was spoken in the comments, and that's when I really know that I'm on the right track. When people tell me emphatically, yes, that's exactly how I was feeling, or thank you so much for shining a light on this disorder that is so poorly recognized. Your comments really did mean so much to me that it started to get into my head that I feel a responsibility to offer something to this community more than just another half-hour lecture on Facebook Live. So tonight what I'm going to tell you about is something that I have been cooking up since I last was with you. I've been working on it dozens and dozens of hours already, and I am so excited to invite you guys in with us to this learning event that I'm going to tell you about. So what I have been so struck by in my research on OT are the missing links between bodies of scientific knowledge. So we know, it is a fact, that OT is due to dysfunction in a part of the brain called the cerebellum. This is in the back part of the brain, and it has historically been known as the balance and coordination center for motor functions in the brain, and that's absolutely one of its parts. But we also know that the cerebellum does a lot more. In the last 20-25 years, it's really gotten its rightful due in brain health history for what it really does, which is, in addition to all the movement stuff, there's a lot of cognitive and emotional functions to the brain. So when I usually search movement disorders like Parkinson's disease or essential tremor, I'm used to seeing multiple bodies of literature where we talk about, here's what we know the motor symptoms are. So with OT, trouble with standing, high frequency tremor relieved upon leaning or walking, okay? Then I'm also used to finding a cognitive set of literature and a quality of life or an emotional set of literature. And it is mind-blowing to me that this really hasn't been brought together with OT yet. So we know in PD what the cognitive symptoms are. We know in ET we're finally starting to really wrap our heads around what the cognitive symptoms are in OT. We know that when the cerebellum is hurt in a stroke or an aneurysm, any kind of a brain injury, we know the cognitive and emotional symptoms that happen. So I am totally perplexed about why this has not happened for OT yet. And what's really bothersome to me is not only has it not happened in the literature, but that certainly means that it has not trickled down to clinical care. So when people go to the neurologist or the movement disorder specialist, my fear is that unless they are on top of the literature on OT, especially the cerebellar literature, and they also know from a whole nother body of literature what the cerebellum does, I'm very concerned that all of you out there living with this are really not getting validated about your symptoms. And what's going to happen to you if you don't understand what the cerebellum does? You could really think you are going crazy. You could think that you're starting to get dementia because you are going to have symptoms like difficulty finding your words. You're going to have some difficulty modulating your emotions. And these, to me, are the very next step that we need to take in the brain health community with OT. It really can't just be thought of as difficulty with standing because it's absolutely more than that. So a few days ago, I did a little secret reconnaissance mission here on Facebook, and I asked you all, if you have OT, do you have trouble with handwriting? And that was my sneaky way of wanting to know about cerebellar involvement above and beyond just trouble standing. Now, many of you answered, which I really appreciated, made me realize I have a very engaged, smart, education-seeking audience. And I understand we could have a self-selection bias with this response because if you didn't have the trouble with handwriting, you might not write in and want to tell me about it. But I don't think that's it. What I really know, and what I know in my brain and in my heart, is that you all are being affected by cerebellar issues that are manifesting in many more ways besides just the motor part, right? Besides just the tremor. So when I asked you about handwriting, that was a sneaky way for me to really understand, okay, so is it happening just when you're standing? Does it also happen when you're seated? And many of you wrote in and you helped me understand that this, I think over 60 people chimed in and said, yeah, this is really a struggle that I have. And I want to use that along with some exercises I'm going to do with you in a minute to show you that the cerebellum is so much more than this motor center, right? I want you to start to think about it like the great coordinator in the brain of all things. We now know it is responsible with the coordination of recall, of words, of short-term memory. It's responsible for the coordination of our emotions, okay? So if OT really is just trouble standing, why are we having non-standing related cognitive issues, okay? So to really make my point, I wanted to pick 2 classic cerebellar tasks that you can do at home right now to kind of start to see maybe very specific ways that your OT is manifesting besides just in the standing issues. So we know that when the cerebellum is being dysfunctional, that there's certain things that we can ask patients to do that really hone in on that anatomical area. The first one I want you to do actually involves taxing the vocal tract and the movements that happen within the motor part of our throat, okay? So these are very sensitive to cerebellar involvement. So the first thing I want you to do is I'm gonna ask you to say a series of 3 consonant and vowel sounds together, and I want you to try to say them fast, okay? So the first one is pa, P-A, pa. Second one is T-A, ta. The next one is K-A, ka. So now I want you to try to repeat those quick. Pa, ta, ka, pa, ta, ka, pa, ta, ka. If you have trouble with that and you have OT, that's validation right there that that is not a coordinated, smooth effort for your brain. The other thing that we do is you can take your dominant hand and lay it flat on a surface, kind of start out with it flat like this. And then I want you to stick out just your pinky. I want you to go back to flat and then stick out your thumb, okay? So if that is an overly difficult thing for you, there is your cerebellum misfiring, and it's not just an issue of standing, right? It's the coordination of different difficult things that your hand, your motor system has to do. But I need to talk to you all about how that happens in other ways, cognitive ways, mental health ways. That is really important. So over this last week, I've gotten a hair across my butt to basically accept this job, if you all will have me. And what I am going to do is in August, on August 14th, I'm going to be offering a 2-hour lecture as a webinar on the Zoom Healthcare platform, in which I'm going to talk to you about the roles of the cerebellum, specifically the non-tremor symptoms in OT. They will be validated and explained. You're going to learn how OT affects you beyond just the troubles with standing and really learn so much about this fascinating part of the brain. This webinar is going to give you the most current scientific thinking on the cerebellum. We're really going to focus on something called the cerebellar cognitive affective syndrome, which really helps you understand how those issues with rapid recall affect things that aren't just related to the way that your body moves or what your neurologist can really pick up on in a short exam. I also really feel the need to talk to you about the 2 most common medicines for OT, which is clonazepam and gabapentin. Now, I appreciate that those help many people, but in my non-OT world, kind of a brain health doctor coming in on this new topic, I was really taken aback a little bit how unfortunately there are some pretty significant risk factors, long-term use issues that I need you to know about those 2 drugs. And it's not to say you can't take them. It's not to say you shouldn't be taking them. I just believe very strongly in you being an informed consumer of your own brain health challenge. And I think with OT, I've never met a condition that begs for people to become educated about their own condition or advocates for their own condition before OT. So I promise you that this is not going to be a negative or a depressing lecture on OT. My goal is to really empower you with science-based education, again, so you can really make sense of your own symptoms and you can go out into the world and know that they're real and advocate for them. So I just can't get over, because essential tremor has been on my mind so much in the last month or 2, when I just think about how hard it was for that group of people to go to their doctor and say, you know, look, I'm having trouble with memory, I'm having trouble with word finding. Well, if the doctor was motivated enough, they could go to the scientific literature and, oh, wow, sure enough, in the last 2 to 3 years, look at this. There's 10 different papers showing us that there would be a retrieval issue with ET. Well, guess what? Those papers are so few and far between in OT. Even if you have a great neurologist, I'm really concerned that they wouldn't even have access to this information. So what I am going to do, what I've really already started to do, is to go through as much high quality research as I can and really synthesize it into a meaningful story for you. Like I said, there's great OT literature out there about the motor symptoms, and there's great research out there about the cerebellum and its non-motor symptoms, right? The emotional, the cognitive, the social. But no one has really joined those two bodies of literature together. And I think I can do it. And I'm up to the challenge, and I'm really excited. So my job is to put that all together in a PowerPoint for you and share it. I definitely become a little obsessed with these projects, rightfully so. I think that's why people give us such good feedback, because they feel comprehensive and they are communicated in a way that is easy to understand, not dumbed down. There's a way to talk about complex brain things that makes sense without it being difficult to access, right? It doesn't have to have jargon. It doesn't have to be complicated, right? But it's pretty complex stuff. So with our Essential Tremor webinar, I estimate we probably put in over 120 hours into the content, and I suspect this will not be any different. I absolutely love researching topics, especially things that I know will empower and educate underserved populations. So I really feel like I've met my match with OT. I am a very strong believer that part of the disability of brain health challenges is the not knowing, is the lack of validation, the lack of explanation, the lack of support. And it is really my privilege to hopefully serve that missing piece for so many of you out there. So as I've been talking, someone from my team is hopefully putting up a link to you to our website. With the webinar purchase, you have access to the webinar, of course, live when we do it. You get a copy of my PowerPoints because they're purposefully dense, and I really want you to walk away with almost like a library of OT, kind of a resource that you can go to in the future. That makes it so there's no pressure to remember what I say as I'm saying it. You have your slides and you're able to write down what you want. We also then send you a link so you can watch the webinar as many times as you want on replay in the future. A portion of the registration fee is going to go to an advocacy donation, the Orthostatic Tremor Research and Education Fund at the Nebraska Medical Center, which I'm so excited to have found them. And so we would just be absolutely delighted to have all of you. I will tell you, everything I've done here on Facebook for the last 3 years has been free, and I love that. It's an absolute labor of love. In the last few months, we have definitely been undergoing a transformation and really trying to think how we can reach people more broadly. And the truth is that there's a lot of costs that go along with doing it. There's a lot of time, like I said, over 100 hours to research these things. So when we do a webinar, there is a fee that goes along with them. I hope that most of you find it to be affordable, and we do also use it as a donation to an advocacy fee. So it's a little different way of getting access to me and the I Care for Your Brain program, but it's really just part of how we have to grow, and I hope you can all appreciate that very much. In September, we are going to be offering a part 2 of the OT webinar series, focusing much more on healing, transformation, changing your relationship to OT, really focusing on the psychological and the quality of life issues with Dr. Renfro, my colleague. Now, some of you, I know you guys with OT are so well informed about the research that comes out on your condition. I think what I can add is kind of adding in this whole new body of literature on the cerebellum. But I know you all saw that paper that came out recently that said there's no quality of life issues with OT. And I about fell off my chair when I saw that. That is one of the most ridiculous things I have ever read in my entire life. So we will not be following that very ignorant insight. It's obvious that there are quality of life issues and limitations. But with all brain health challenges, we always approach it from a position of psychological strength and really believing that the more you know, the better off you're going to be. I really, really believe that. So we are limited with the amount of people that we can see on the webinar. I know that we have a lot of great supporters in Australia and England, and that the time that we pick here in the US, which is going to be 12 noon to 2 in the afternoon, is sometimes not perfect for you all. I actually have this kind of dream that maybe we're going to get so many people wanting to attend the webinar that if we had the right numbers, we could actually offer it twice and try to have a time that was really convenient for you all, not in the United States, and then I could do another one for folks in the US. So I can't promise that out of the gate. We would really have to have enough people sign up for that to make sense. But it would truly be my pleasure and my honor for you all to join us on the webinar on August 14th. I'll be talking more about OT before that on this channel. If that's what you are able to join us for, that's awesome. But if you are able to access this additional resource, I think it would be very beneficial. I will be back next week talking about internal tremors for a very special lady who's asked me to do that a few different times. So I look forward to getting into that body of research. Thank you guys so much from the OT community. It has really been my pleasure to get to know you more in this last week. And I am just so excited that we've met because I feel like we have a lot in common. I have been blown away by the Facebook groups and the support groups that I've been searching on a little bit, the respect for research, the peer support, the community that you all have formed is just really, really been touching to me. It's kind of the whole reason that I actually do all this, is to see groups of people who can really support and relate each other get together and share high quality information. There's really nothing that I know that would help folks with brain health issues more. So thank you guys so much. I hope that you think about signing up, and we will have such a good time on that webinar, I promise. Thank you guys so much and take care. Bye-bye.